Hi, my name is Cindy Farn. I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today's Thursday, June 25th, and this is my daily briefing. Missoula County currently has 18 active COVID-19 cases, with 4 new cases today. We currently have over 130 close contacts. Active cases and their known contacts are in quarantine and isolation, and will continue to be monitored and supported by medical staff as needed. To date, we've had 62 cumulative positive cases of COVID-19 in Missoula County. 60 of those were identified by testing and 2 were epi-linked. We've had 43 recoveries and 1 death. Currently, no Missoula County cases are hospitalized, but we do have 1 case hospitalized from another county. The state of Montana is currently reporting 803 cumulative COVID cases, of which nearly 40 are new cases today. That's the highest number of newly reported cases that we've seen since the outset of our response efforts. There are currently 15 hospitalizations across the state, and there have been 21 deaths related to COVID-19 statewide. Today I'm going to talk a little bit about case clusters, which we might be seeing more of now that we're nearly 4 weeks into Montana's phase 2 reopening, where travel restrictions were removed and group size limits were increased. A case cluster is exactly what it sounds like. It's a group of cases typically bound by location and time. We might see clusters at specific work sites, whether it's in an office space, a salon, a classroom, or something else. And we might see clusters arising from specific events like larger gatherings, family reunions, work meetings, or neighborhood potlucks. Take, for instance, a family reunion where family members come from all over the state to a specific county and to a specific home. All of those people are arriving at a single place at a specific time, and they're arriving with different levels of COVID-19 exposure, whether it is large case counts in their different communities or whether it's their individual profession that might put them into close contact with other individuals for extended periods of time, like teachers in a classroom or servers at a restaurant or bar or something else. I share all of these nuances and details because those are some of the many key factors that play into COVID-19 exposure and transmission, as well as what is taken into consideration when we're identifying, investigating, and tracing contacts and their exposure for testing, quarantine, and isolation. We know that the more people that an individual interacts with and the longer that interaction lasts, the higher the potential of risk of becoming infected with COVID-19 and spreading it. The higher the level of transmission in the general area, in this case, Missoula County, the higher the risk of COVID-19 exposure and transmission happening at the specific location or event at a specific point in time. A key concept of case clusters is that the increase in cases is significantly higher than by chance alone. Various exposures in the environment play into creating a cluster, and we identify those factors during case investigation. Once we have a positive case and we conduct contact tracing, we start seeing disease trends. And it's during those initial analyses that we can determine if a new set of positive cases might be related to a specific location, event, or point in time. By asking a handful of questions, we can start identifying the scope and breadth of the set of cases, including if it's part of a cluster. Examples of these questions that we ask during our cluster analysis include: are the rates of COVID-19 greater than expected with regards to person, place, and time? If the observed rates of COVID-19 are greater than expected, is there documented exposure that could explain this cluster? Were all of those contacts at one site or one event? Were they there at the same time? Were they in close proximity together? Are there alternative explanations for the disease? Remember that we have to explore all possibilities in order to really drill down into what we're actually seeing. Are there specific subgroups that might be at an elevated risk of acquiring the disease and being disproportionately affected by it? For instance, if someone is a close contact to a cluster, we would want to ask about pre-existing health conditions along with the length of time that they were at the site or the event, the number of people that you interacted with for more than 15 minutes, less than 6 feet apart. This information is all really helpful because it helps guide the appropriate individualized care planning for that specifically meets that close contact's needs. This takes a lot of careful, detail-oriented, and compassionate work from a lot of dedicated public health staff. We also ask about the site or the event itself. We want to ask what safe behaviors or safe environmental cues were put into place. Were face coverings being used? Were they recommended or were they required? Did you have guidance or rules in place regarding cloth face coverings? Were they followed? Were there partitions or more than 6 feet of distance between different groups, and so on and so forth? These types of questions really help us better identify why the cluster happened and as well as how we might mitigate any future clusters or cases at that site or that event. Throughout the entire investigation, we have ongoing transparent communication with all parties while maintaining patient privacy and confidentiality. If the site is a workplace, we remain in communication with the owners and managers and safety officers if the site has that position. As soon as we learn of a case within a specific environment or at a specific event, we notify the site, whether it's a workplace, a group co-working space, a gym, a restaurant, or whatever it happens to be, about the active case, potential exposure, and a heads up about case investigation and contact tracing efforts that are about to get underway so that we can quickly and safely identify all possible close contacts and get them into quarantine with medical support as soon as possible. After initial contact with the organization or facility, and after close contacts have been identified and quarantined, our health and safety staff work with the organization or facility to identify ways of enhancing safety at the site. Think about all those things like indicating 6 feet on the floors or walls with painters or painter's tape or stickers, having hand sanitizer at the entry, having signs asking you not to enter the facility if you've been experiencing COVID-like symptoms, having a well check-in station for staff, having staff wear cloth face coverings when they are outside of their individual office spaces and 6 feet cannot easily be maintained between different people, and other different setups that we might be able to do to enhance the safety at that site. As quickly as we can safely do so, we get those close contacts that are in isolation into testing. This is something that we're now able to do through our sentinel testing and increased supplies. Previously, the county testing clinic prioritized testing for symptomatic county residents since we've had historically limited supplies. Now with increased supplies and some increased contact tracing capacity, we can test close contacts at a certain point within their quarantine period. Please note that while we will test the close contacts, a close contact still needs to remain in quarantine for the full 14 days, since that is the typical incubation period for the virus. You will at least know if you have, let me try that sentence again. You will at least know if you have COVID at the time of testing, and you will absolutely be supported by medical staff throughout the duration of the quarantine, as well as help through any additional necessary steps. Instead of recording close contacts as presumptive positives or epi-linked without testing, we will have better data from comprehensive testing and about COVID-19 trends in the county that will inform our response efforts moving forward. Contact tracing is a bit of a Herculean effort, especially when a cluster is involved. That means that in a short amount of time, contact tracers need to address a significant bump in their caseload all at one time. Doing this work effectively and accurately really requires diligence, patience, and care to identify people that are most affected, assess the level of risk, and determine the best next steps for each person affected. Some professions inherently involve closer contact with a lot of people for extended periods of time, while others of us may have more flexibility around our work and home environments. So this is why we just want to encourage you to keep your social circle small to balance the inevitability of case clusters that are a heavy but manageable load for our contact tracers. So that's all I have for my daily briefing today. Thanks to everyone out there for doing your part to keep our numbers manageable here in Missoula County. As always, you can subscribe to me on YouTube under my name, Cindy Farr, CindyFarr. Click that notification bell so that you get notified when additional videos are uploaded. Follow us on Facebook at the Missoula City County Health Department's Facebook page. You can also call 258-INFO for more information about COVID-19, or if you would like to schedule a test through our drive-through testing facility. You can also check out our website at missoula.co/cvirus. And just a reminder, we are still hiring here at the health department, so get in touch with us if you're looking for a job. All right, thank you everyone, and until Monday, stay healthy.